Did you know that acid reflux can lead to Barrett's esophagus, which increases your risk of developing esophageal cancer by 150% over the normal population? Did you know that adenocarcinoma or esophageal cancer is increasing in incidence by 600%? And did you know that gastroenterologists and surgeons have very different treatment algorithms when it comes to treating Barrett's, which means depending on who a patient sees, they'll get very different answers and probably never have all of the information needed for them to make critical decisions about their care. I'm Dr. Caitlin Houghton. I'm a foregut surgeon, which means I have a special interest and skill set in treating diseases of the esophagus and stomach. But in this series, I'm a patient advocate. My Uncle Pat got diagnosed with Barrett's esophagus and came to me for advice. Uncle Pat,
Yes.
Tell me about your symptoms and why you went for an endoscopy in the first place.
Symptoms were coughing, acid reflux of some sorts, not constantly, but most times.
Food getting stuck?
Yes, foods typically got stuck in my throat at certain times, but wasn't overbearing part, but it was there, and you suggest that's not good.
What did the scope show?
The scope showed that I had Barrett's, and it's 7 centimeters long. I had a hiatal hernia, which he said could be concerning, but it can be taken care of by watching it.
You're in a high-risk category because you're a male over 50, a white male over 50 is actually the category risk factor. Previous smoker, have had some acid reflux in the past, and a strong family history.
Yes.
So I think that's part of the reason, after hearing your symptoms and knowing, like me, understanding that those risk factors, really pushing you to get an endoscopy.
Yeah, I'm glad we did it and figure out what's the best options for the next years of my life.
I knew exactly what to do for Uncle Pat. I take care of patients like this all the time. However, the recommendations he got from his gastroenterologist were very different from what I recommended. I remember having a conversation with Dr. Apanagari and really respected him. He knew the guidelines, he knew the GI guidelines, he was very intelligent, but something he said at the end of our conversation had me a little bit confused.
Besides medical management, we can send him to a surgeon, but our guidelines for his situation say do not operate, and I'm pretty sure any surgeon we send him to would probably not operate on him.
I hung up the phone thinking, but every surgeon I know would operate on Uncle Pat. So together, we're setting out to find answers. We really want to understand why surgeons and gastroenterologists have such different treatment algorithms for Barrett's esophagus when the stakes are really high if we get it wrong.
Come with me as I seek information from my gastroenterologist, and then come with me as I seek more information from a foregut surgeon.
We really want your comments and advice as we go along. We want to come up with the best treatment strategy for Uncle Pat.
Thank you. See you at my next appointment.